back. In today's video, we are going to be going over immunity and infection. We're going to be looking at special consideration for older adults, as well as the different types of immunity, different types of immunoglobulins, and how to assess and test for infection, looking at the risk factors for infection, as well as the signs and symptoms of infection. The first topic I want to address is considerations for elderly patients. An important thing to take note of is that as patients get older, neutrophil function will begin to decrease. And what that looks like is that those cardinal signs of infection, such as redness, swelling, pus secretion, don't show up when infection occurs. So in other words, those signs of infection that we're so familiar with are not present. We don't see them. And this follows a trend that a lot of things in elderly patients when it comes to fighting infection decrease. White blood cell count may not elevate during a period of infection. B lymphocytes in elderly patients, which are responsible for creating cells that secrete antibodies, decrease. T lymphocytes, which are responsible for fighting the foreign pathogens themselves, decrease. The amount of time that the body is maintaining a immune response decreases. Natural antibodies decrease. It's a general theme of as you get older, your ability to fight infections reduces, and that's something we need to be aware of in our patients, because not only are we going to be at a more difficult situation to find the infection signs, but also we're going to have to be more aware of how we treat them because they are already at a disadvantage for fighting infection. Next, I want to talk about the types of immunity that we are responsible for knowing. There are four main types that we're going to be encountering. They are passive, active, humoral, and cellular. The top two, the biggest difference is that passive immunity is something that is short-lasting, and it's usually found in infants, and it's passed through their mother's breast milk. So an infant receiving breastfeeding from their mother is going to start to build that passive immunity to some pathogens to help protect them as they continue to develop. Active immunity is something that we all have, and it lasts for a long, long time. It is usually developed by some sort of encounter with that foreign pathogen. So whether that's a previous infection that you got over or a vaccination which introduced you to a dead strain of the foreign pathogen for your body to develop those memory cells and antibodies, that's where active immunity comes from. Cellular immunity is in direct response to some sort of foreign pathogen, bacteria, fungus, a virus. So your body activates the T lymphocytes to go and find the enemy microbe and attack them and eliminate them from the bloodstream. Humoral immunity also takes place in the bloodstream, but humoral immunity activates the B lymphocytes, as we mentioned earlier. They are responsible for maturing into those antibody-secreting cells, so that humoral immunity will go and send out those B lymphocytes to just kind of broad spectrum take out whatever is infecting you. Next, I want to talk about the different types of immunoglobulins and where they're found most abundantly in the body. Immunoglobulin G is found in pretty much all bodily fluids. It's the most abundant immunoglobulin in the body, and it's responsible for helping to protect against bacterial and viral infections. Immunoglobulin A is found mostly in the mucous membranes, especially those in the respiratory tract, as well as in saliva and tears. Immunoglobulin M is found in the blood and lymph fluids, and is the first antibody to respond to a new infection. And that's why your lymph nodes swell, because that's where the immunoglobulin M antibody is found. Immunoglobulin E is found mostly in the lungs and skin. It's mostly in response to allergic reactions. Basically, when the body has an overstimulation of environmental allergens like pollen or dander, that's when immunoglobulin E gets activated. Lastly, immunoglobulin D is supposedly the most mysterious. It's found in small amounts in the blood, but it's the least understood. Don't know much about it yet. Alrighty, next I want to talk about risk factors for developing infection, and what I have presented is what is possibly the worst patient situation I could have thought of. I've tried to include almost every risk factor imaginable, so let's go through them one by one. This is our patient. This is Mrs. Patient, and let's take a look at some of the things she has going on that could lead to risk for infections. First of all, let's say that this calendar here started when she was admitted. That's almost her second week in the facility. Length of stay, extended length of stay, can put patients at risk for a hospital-acquired infection. Additionally, this patient has a Foley catheter placed and she's incontinent. She is sitting in stool, so that is a huge double whammy. She's got a pressure ulcer on her heel that puts her at risk for infection. She's got wrinkles, she's old, that puts her at risk for infection. She's got a PICC line in her arm that puts her at risk for infection. She's got massive arms, she is yoked. She's got long-term steroid use. That puts her at risk for infection. And here you are, their caretaker, smoking a cigarette that you got from her room because you took a peek in there and saw what was about to happen to you and you don't want any part of it. Smoking is also a risk factor for patients that puts them at a greater risk of infection. This took much longer to draw than it did to talk about, so please appreciate the art. This is buffer time so that you have time to look at the art. I almost forgot to mention, she's got an abdominal surgical site. Also puts her at a heightened risk for infection. So now that we have an idea of what risk factors for infection look like, let's take a look at how we can assess for additional signs of infection. I know there's a lot going on. Again, I am not an artist, but I did my best to try to cluster it for you and we can break it down piece by piece. So Mrs. Patient was going crazy with risk factors for infection. So we, stick nurse, want to take a look at a few potential things. The first thing I have the stick nurse doing is we're going to be palpating those lymph nodes. They have a very flexible arm, so they're bringing it all the way over to make sure they get into that lymph node area. We're also going to be auscultating the lungs, listening for increased respirations, maybe potentially any crackling or wheezing from a pneumonia infection. We're also going to auscultate the bowel sounds, but stick nurse can't use two stethoscopes at the same time, so that's what they would do next. We also want to get a complete set of vital signs. We're taking Mrs. Patient's blood pressure, her temperature. We'd also check her SpO2, as well as maybe a quick pain assessment, things like that. In addition to our physical assessment, there's also a variety of labs and diagnostic tests that we can utilize to help reduce the potential causes for an infection to help narrow down our treatment. First being white blood cell count and the complete blood cell count, I do want to remind us that it is important to consider your patient's background when viewing these kind of results. An elderly patient, as we discussed before, may not see a rise in white blood cells as a result of an infection, and a patient who might be neurogenic may not have a white blood cell count elevation level that is above the baseline normal range. So being aware of those background pieces of information can just kind of help you guide your nursing diagnosis. The erythrocyte sedimentation rate, the ESR, that is kind of where we identify where inflammation is happening. An elevated ESR is indicated by inflammation. Urinalysis and culture insensitivity are a couple of those process of elimination tests that we can use to really kind of knock out potential other causes for symptoms, and especially requesting physician's orders to get an appropriate antibiotic if it's a certain bacterial infection, because using a culture insensitivity test, we know what type of pathogen we're dealing with. MRI and CT scans are a part of those diagnostic imaging tests that we can use, and it's another rule out kind of process where we use the images, the body tissue and the soft tissue to eliminate other potential causes of infection. A lot of this is used to guide how we treat the patient, and that's the big takeaway for using these types of things. If we've managed to successfully identify an infection, it's important to begin taking steps to minimize risk of infecting other clients, as well as preventing further infection of the patient. Health promotion is a very easy and big way to do that. Washing hands, just appropriate hand hygiene in general, is probably one of the most important primary prevention tools we have, not only to just prevent the spread of hospital-acquired infections or community-acquired infections, but also to prevent any further infection in the patient that we are currently dealing with. In addition, for the patient themselves, things like nutritional therapy, immunization therapy, and bed rest when necessary all act as added support to help prevent further infection. In addition to health promotion, another thing we can do as nurses to mitigate risk of future and further infection is address the patient's altered function if they have an infection. This can include comfort measures, such as treating the patient's infection symptoms as they occur, as well as providing supplementary therapy like having the patient ambulate and have activity throughout the day, giving them respiratory treatment, having them cough and breathe deeply. And another big thing that we're going to see a lot as we transition into new facilities is contact precaution signs, or just infection precaution signs. These can be used to communicate to all members of the healthcare team the type of infection that a patient is dealing with, as well as the appropriate protective gear to use when entering the room to perform healthcare of some kind. This is a precaution sign for Mrs. Patient, who we were dealing with earlier. It seems that she is on JAS precautions, so I know as a healthcare member of her team that I need to don gloves, gowns, and a saxophone before entering the room. And that's an overview of infections and immunity. I'm probably going to revisit this with a little bit more detail in stuff like the immunoglobulins as I learn more, but I just wanted to have this out there in my parts so that I can edit as necessary. Thank you guys so much for watching. New video drops tomorrow, maybe.